I'm doing an environment check. All I have here is my alcohol pads, patient, and there's the room. There's my alcohol pads again. Okay. So now I'm going to begin my assessment. Come in. Provide privacy. Hand hygiene. Hi, my name is Kiara. I'm going to be your nursing student today. Can you give me your name and date of birth?
Caitlin Burgandy, 3603.
Awesome. Can I see your bracelet? I'm going to scan that. Do you have any allergies?
Nope.
Okay. So today the physician has ordered a cardiac and abdominal assessment. I'm just going to listen to your heart and kind of look at it. Same with your abdomen. Look at it, listen to it. Just make sure everything's working okay. Before we begin, do you have any questions or concerns?
Nope.
Okay. Are you in a comfortable position?
Mm-hmm.
Okay. So first, I'm gonna assess your color. I'm gonna look for cyanosis, which is blue, which would indicate you're not getting enough oxygen, and paler would be maybe you're not feeling well. Your color looks good. So next, I'm gonna ask you a few questions. So for your heart, do you take any heart medications?
Nope.
Okay. Do you have any chest pain?
Nope.
Have you ever had any heart surgery?
Nope.
Okay. And then for your abdomen, do you have any tender spots?
Nope.
Have you ever had abdominal surgery?
Nope.
And when was your last bowel movement?
Yesterday.
Awesome. So before we begin, do you have to go to the bathroom at all?
Nope.
No. Okay. So I'm going to first test your capillary refill. I check your fingernail. I'm just going to give it a little pinch. Awesome. Instant refill. I'm going to check your toe. Instant refill. Good. Now I'm going to check for edema. I'm going to check your lower first. Your proximal bone prominence. So you are a grade 1 of edema. Grade 1 is 2 millimeter indentation with instant rebound. Grade 2 is a 4 millimeter indentation with 10 to 15 second rebound. Grade 3 is 6 millimeter indentation with a 1 to 2 minute rebound, and grade 4 is a 8 millimeter indentation with a 2 to 3 minute rebound. So you are a grade 1. I'm also going to check your upper extremities, also a grade 1. So next I'm going to assess your color, warmth, movement, and sensation. So your color is good. You're not yellow or blue or pale or anything. Your color feels good. You don't feel warm, like you have a temperature at all. Can you move around a little bit for me? Good. Your movement is good. And your sensation. Can you close your eyes for me and tell me what I'm touching?
Thigh.
Awesome. So next, I'm going to do your peripheral pulses. I'm going to have you sit up on the edge of the bed here for me. So I'm feeling your pulses for rhythm and equity. So I'm going to start with your temporal. They beat together with the same strength, and they're both strong, but not bounding and not weak. Next, I'm going to do your carotid, one at a time, so I don't prevent blood flow to the brain. And they're equal and the same strength. Next, I'm going to do brachial. Equal, same strength. Good. Then I'm going to do radial, equal, good strength. Then I would do femoral. We're going to verbalize that because that's a personal area and we would only touch it if it's necessary, which is not at this time. I'm going to patellar, posterior tibia bone,
So actually it does go with 4.
and top of the foot.
There are 4?
Alright, so the peripheral pulses were all equal and feet together. So now I'm going to have you lay back down. And I'm looking at your jugular vein distension. So I'm looking for any palpitations coming from that, which I don't see any, so that's good. You turn your head towards me and the other way. Awesome. And there's also no chest palpitations, which is good. So next, I'm going to clean my stethoscope. I'm going to listen to the carotid artery. I'm listening for what's called the bruit, which is like a swishing sound, which you don't want to hear. So if you hear nothing, that's good. While I'm doing that, I'm going to have my patient hold her breath. All right. So can you hold your breath and turn your head to one side for me? And I'm listening to my bell. Good. And then your other side. Good. So there's no swishing sound, which is good. So next we're going to move. I'm going to ask. We're going to move your chest. So can I have you unzip your sweater for me all the way? Maybe. There we go. All right. So first I'm inspecting the chest, making sure it's even on both sides. I'm looking for any scars that might indicate surgery, any moles that look suspicious maybe look like they have to be looked at. Do you have any tender spots or anything? Okay. So now I'm going to palpate the precordium, and if there aren't any palpitations, those are good because we don't want to see those. I'm just going to use the palm of my hand. Let me know if anything's sensitive. I'm going to make sure they're even like this. Okay, so that feels good. So now I'm going to listen to your heart. I'm going to use my diaphragm first. And I'm going to start at the aortic. I'm going to find the second intercostal rib space. It's right here. And I should hear lub dub. That's good. And then I move across to the pulmonic. And I hear lub dub. And I move to the Erb's point, which is the third intercostal space. And I move to the tricuspid, which is the fourth intercostal space, which is good, lub dub. And then can I have you lift your breast for me? And listen to the mitral, which is the fifth intercostal space. Sounds good. And while I'm at the mitral, I'm going to take the apical pulse for a full minute.
documentation.
Alright, so we got 62. So that's a good apical pulse. Next, I'm going to listen to your heart with the bell of my stethoscope. Listening for higher pitched sounds. We're going aortic, pulmonic, Erb's point, tricuspid, and mitral. And you lift your breast again. Awesome. So, next I'm going to explain S1 and S2 sounds. S1 is lub, S2 is dub. So, the base of the heart is up here. The apex of the heart is down here. The apex of the heart is where you hear S1. And the base of the heart is where you hear S2. So you're going to hear S2 when you're up closer to the pulmonic Erb's point, and you're going to hear the S1 when you're down towards your tricuspid and mitral. So next we're going to move to the abdominal assessment. First I'm going to inspect. I'm looking to make sure it's even, like both sides of the stomach are even. Looking for any scarring that might indicate surgery. Looking for any lumps or bumps. Coloring looks good. And I'm going to ask you again before we start this assessment, do you have to go to the bathroom at all?
Nope.
Okay, you would want to empty your bladder if you did have to go to the bathroom. And I'm going to raise the feet a little bit and the head to kind of cradle the stomach, relax it. Are you relaxed? Are you comfortable? Okay. So, inspection. Both sides are even. Awesome. Pulling it down for me. Now I'm going to listen. And it's important to listen before you palpate because when you palpate, it can cause bowel movements. So I'm listening for bowel movements right now with my diaphragm. I'm starting in the right lower quadrant. I'm going to work my way around. And I hear bowel movements, which is good. That's what I want to hear. If I didn't hear any, I would listen for a full minute. If I still didn't hear any, I'd listen for 5 minutes. And then if I didn't hear any, contact the physician. I hear bowel movements, so we're good. Next, I'm going to move to percussion. So this is just hearing whether it's hollow or solid. If it was solid, there might be like a lump under it or something. And there's still no tenderness going on.
Nope.
And it sounds good. So next I'm going to palpate lightly. Starting in the right lower quadrant. Any tenderness. Feeling for any bumps. Right upper quadrant. Left upper quadrant. And left lower quadrant. No lumps or bumps or tenderness. So now I would palpate just a little harder. Alright, so now I'm going to listen to the aortic, which is right here, the artery, the renal arteries, and the iliac arteries. with my bell. Can I have you lift up, wait. Can you lift up your bra just a little bit? And for the aortic, you just don't want to hear it bounding. It's okay to hear a little bit, which I hear just a little bit. I'm going to go to the renal. I'm going to go to the iliac. Okay, everything sounds good. So, that is the end of our assessment. So, before I leave, do you need anything? I have time.
Nope.
I'm just gonna place the bed back down to its position. And then as far down the ground as I can, make sure it's locked. Bed rail's up. Here's your call light. Bed's down and locked. There's no obstacles in the way. The bed table is within reach of her. And at this time, I will clean my stethoscope. And I will provide hand hygiene. Are you comfortable?
Mm-hmm.
Okay. And then I will exit providing privacy.